Everybody, it is Doc Talk for Thanksgiving coming up, and being with friends and family, and an opportunity to again celebrate a great country, the job that I just love, working in the fire service, the best job in the world. I'm also in a new site here today, working with a great department that I get to be part of. So you may see this background a little bit more in the future. Last week, we talked a lot about the vaccines, and I got a lot of really good questions and feedback explaining the vaccine and the vaccine plus infection and all the variants that go along with that. Please keep those questions coming in. If I can help you understand the vaccine programs, the different ages, the different availabilities. This week, the biggest news really is the effective beginning of pediatric vaccination programs, age 5 to 11 with Pfizer pediatric dose. Many communities are holding vaccine events around their schools and around other events that are friendly to children, and begin the process of immunizing the younger populations. Getting them out of masks and in schools together. The isolation with the kids has really had an intense effect on that generation, and we're doing everything we can with the school systems to make sure that the school systems stay safe. And the vaccine program is intended, again, to take this vaccine, to take this illness, coronavirus 19 illness, down to levels that are tolerable, where we don't have to worry about variants, and where we don't have the death tolls that we continue to have. So this week's topic really is a thoughtful one, and it's about what we're doing to get into the next phase, a new normal. And as we early on defined, we're in phase 4, which is attempting to return to normal operations, and phase 5, which is how do we fill the gaps in our emergency system and in public safety that have come as a result of the coronavirus. One of the discussion items around this is, what does it mean to be an endemic illness versus a pandemic illness? And so that's been in the news a lot recently. I thought I'd try to explain it. There is no single definition that says when any illness goes from being a pandemic and to an endemic. But what endemic really means is that some type of illness has become a part of the healthcare system, but which the healthcare system is capable of taking care of without extraordinary measures and without huge impacts on deaths and disability. Our recent last week numbers are showing that the COVID counts are coming to what's probably a new plateau across the country. There are still local outbreaks that are occurring, and devastating news yesterday of another senior care facility in the northeast part of the country where a number of staff members and, more importantly, the residents have died. So we still have vulnerable populations, and anytime we have an illness that still is running through the population, we have the chance that vulnerable people will succumb, they'll die because of the illness, and that even some people who not known to be vulnerable are going to die. In an endemic state of an illness, the health systems are capable of taking care of the manifestations of that. So every year we have the flu. In some years worse than other years because of the type, the strain of flu that is going through. In most communities, we're able to take care of flu patients. During pediatric COVID outbreak season, RSV, another endemic illness in the population worldwide, where during the busy times when RSV is spreading, the children's hospitals are still capable of taking care of the children that have RSV. What is somewhat troubling about our current state of COVID is we have a lot of people who are suffering from long COVID, from prolonged symptoms and prolonged disability. There's a variety of manifestations of that, including people who don't have their taste and smell, who have chronic fatigue, who have chronic impairment of lungs and cardiovascular function, at least to this point, which is a year to a year and a half after their original infection. This is something that is a symptom of long COVID and a problem with long COVID that we don't necessarily have with other viruses. In general, when people get infections with viruses, they get over them and they don't have these long-term manifestations. There's weird viruses, and I'll use varicella as one of them. Chickenpox as a child. The varicella lives in a unique area of the body for a while, and then in some people it breaks out on a single nerve root. That's what's called shingles. And shingles, for people who have it, is a miserable experience. And we have some capability of reducing the incidence of shingles by giving people shingles immunizations, but we can't completely eradicate that. The problem with our COVID illnesses and the long time manifestations that come afterwards is we don't know when necessarily they will end. And there seems to be a relatively larger percentage of people who develop some long symptoms. And if that impacts people's health in the long term, is another really good reason why we need to keep this virus at a very low level and eliminate it if possible. What's happening to get communities back to normal are a few things. Number one, we're trying to restore the capabilities of our health systems and our hospitals. In many of our organizations, we're still making good decisions about not spreading infections, including coronavirus. So we're having some flu outbreaks. We've been having RSV outbreaks amongst the pediatric population for some time. We're doing a lot of respiratory testing when people have respiratory symptoms. So we're getting COVID positive results. We're getting influenza B and influenza A positive results. We're getting RSV, and then we're getting some of the other viruses that are kind of a routine part of fall and winter in America. Where we can reduce all of those is wearing a mask, staying home if sick, which is a completely new culture and discipline for us in fire and EMS because we don't like to stay home. Washing our hands, making good decisions on being around crowds and when we need to protect individuals that may be in those crowds, including ourselves. Contact tracing is going to come back into vogue, where we have the capabilities of identifying COVID or other infections and being able to trace through who might be exposed, and then having them do a symptom watch and quarantine if necessary to avoid more people getting infected. And then finally, protecting vulnerable populations so that still when we go into areas or we deal with individual patients who are vulnerable, that includes people with terminal illnesses, that includes people who are in hospice care, in dependent care living areas of our senior care facilities, people who have cancer undergoing the intense portion of their therapy, that we need to be very careful around them and make sure that we mask and prevent us from spreading an infection to them. Really important moving into the winter is that EMS and the hospitals be on the same page in terms of dealing with surges and in terms of dealing with hospitals that are at very high capacities because of seasonal illness, because of COVID, because of people trying to make up for the healthcare that they didn't get when they were afraid to go to the hospital or the health systems had kind of shut down. What's really important is to prevent wall times from getting long and EMS from getting stuck in the hospitals waiting to offload patients so that they can't get back in service out in the community where they need to be. Those are really planning aspects, and we have a relatively short window of preparing our health systems, our hospitals, and our community's emergency systems so that we can handle surges this winter that are very, very likely to occur. You will have heard this week about more treatments being approved for COVID. And in particular, there's two types of oral treatments that are before the FDA in the approval process with varying levels of effectiveness. Again, a very important message is preventing the disease is better than trying to treat it once an individual has it. Nonetheless, we're going to have some people who get infected, and we need to have some treatments available to them other than high flow oxygen, isolation, and supportive care, which is really the essence of initial coronavirus care if you get the illness. It is possible that over the next month, we will have those treatments available. We still have and being used frequently the monoclonal antibody treatments. And this past week, I had to use that for a couple of our firefighters who were ill with coronavirus and needed to have additional care that would allow them to not have serious manifestations of COVID. So we are beginning to have some treatments, more experience with it, but we don't know if these new oral pills are really going to be as effective as we would like them to be. And again, very importantly, vaccination is part of getting rid of this disease, not only in this country, but across the globe. We are reopening up our travel, reopening up our borders. So it is possible that we will see some more surges as coronavirus begins to travel the planet again, and as people begin to travel. Even more important in 2022 and in 2023, when more of the travel channels get opened, that we don't have pockets of coronavirus that pop up across the globe and cause stresses to the health system and deaths amongst people who would ordinarily not be dying. So we're moving into Thanksgiving time. Important for you is that you plan your events and plan for safety for you and your family. You stay home when you're sick, and so please, if you're heading into the family time and someone's being ill, they need to stay isolated and away from the main group of people. Where possible, you wash your hands and stay safe yourself. If it's appropriate to wear a mask to prevent you from spreading infection or you from getting infection, that might be appropriate. But we want to enjoy our family time, and we want to give thanks at the time of year when that it is really the nature of our culture and our country, and we really do have a lot to be thankful for. Doc Talk for this week. Please stay safe. Plan ahead in a couple areas that I talked about here. Stay up with the news. Get vaccinated if you haven't gotten vaccinated yet. Thanks, and I'll talk to you next week.